Do you wake up in the morning and feel a sharp stabbing pain in your heel? If so, you might be dealing with plantar fasciitis, a common cause of heel pain. This happens when the plantar fascia, the thick tissue under your foot, gets overstretched or irritated. It's often seen in runners, those who stand for long hours, or wear unsupportive shoes. The classic symptom is heel pain that's worst in the morning or after sitting for a while, but eases as you move. But remember, heel pain can also stem from other issues like heel spurs, ankle tendon problems, nerve pinching, or arthritis, so see a doctor if it persists. Plantar fasciitis is diagnosed by its classic symptom of heel pain, confirmed by a physical examination. A healthcare provider will likely find tenderness around the medial calcaneal tuberosity, which is the bottom of your heel bone. The role of imaging in plantar fasciitis is supportive rather than primary, since diagnosis is usually clinical. X-rays may be used to rule out bone spurs, stress fractures, or arthritis. Ultrasound may show plantar fascia thickening or tears and guide injections. MRI is reserved for atypical or severe cases to exclude other heel pathologies such as tumors or nerve entrapment. The good news is, most cases improve with simple treatments such as rest, ice application several times a day, stretching, using cushioned shoes or heel pads, losing excess weight, and taking pain relievers like ibuprofen. For stubborn cases, doctors might suggest night splints, shockwave treatment, or physical therapy. In rare cases, corticosteroid injections or partial plantar fascia release surgery, also known as plantar fasciotomy, may be necessary. Treatment of plantar fasciitis often starts with primary care measures, but podiatrists may be involved for specialized care such as custom orthotics, advanced therapies, or surgery in stubborn cases. So if heel pain is slowing you down, know that recovery is possible with the right steps. If you found this helpful, like, share, and subscribe for more quick medical insights. This is Dr. Aid, keeping medicine simple and clear. See you next time.